me. Well, thank you everyone. Thanks, Michelle. Just move that over. Really great to be here today. Just want to also acknowledge and pay my respects to the Gadigal people, the original stewards, as Michelle mentioned. It's great to be here talking not just to people in the waste sector, actually to be talking to people, health practitioners, those that are interested in doing something around cycling away from plastics. I was really attracted to the title. In 2019, my colleague Nathan Tuvey, is not here, and we were able to do a bit of a deep dive in the health sector in Victoria. We were sticking our heads into bins around 6 different regional and city hospitals in Victoria. We were able to do a survey of a number of practitioners around the state just to get a better understanding and engagement around some of the priorities from a practitioner's perspective, some of the challenges and opportunities to sort of look at reducing and opportunities for recycling waste. A lot of challenges, but a lot of passion, and it always really stayed with me, and it's something that we sort of carried through. So really happy to be here. And the cycling away from plastic, really interpreting that around reducing our reliance on the plastic front while acknowledging the role of recycling. And it's great to see that as a focus. It's not always the case. Circular economy and all the terms get bandied around, but there's always a lot of focus on recycling and not so much of a focus on the reduction. And so just great that that's part of the talk today. Other speakers have touched on it. We did a little bit of work in the Northern Territory recently around trying to look at their current recovery of plastics, and there was a little bit of a focus on plastics in the health sector as well, and we just wanted to list a few things there as the different resin codes, and that a number of products, as has been touched on by previous speakers, there's composite materials, there's multiple types of plastics embedded in the one product, and it's not just plastic, it can be plastic and metals or plastics and other materials. There's a complexity there. And also with the one product, different manufacturers may have different types of plastics, within those different products. So the selection between products at a procurement level, depending on the product, it might be doing a similar thing. They all have different sort of opportunities around recycling. Just want to make mention of PVC. It's already been touched on. It's relatively prevalent. Estimates of around approximately 20 to 25% of plastics in health, so it's quite a large component. And once again, I guess it's not, for some of those products it might be PVC from some manufacturers, and others it might be a mix of materials. Just wanted to make the point around procurement. In terms of the related costs and medical items, as I sort of touched on, it's separate from the procurement of waste services. So if you think what I'm trying to say there is really waste service contract in a hospital, you might go out and procure that. You've got your clinical waste, your general waste, recycling. Sometimes it's bundled all within the one contract, and it might be a lead service provider from a waste sector that has a particular focus on the clinical, and then they're all at different sort of costs on a tonnage basis or a volume basis. So there's a little bit of a disincentive there, you could say, around how that sort of works, and it's separated from the cost of the items themselves in terms of the procurement process, something just to keep in mind. And then we've talked about the infection control dynamic with clinical disposal. In some cases, this is going back and drawing on the work that we were doing and the engagement we were having back a few years back, but I think it's borne out for others. The clinical waste disposal is a lot higher in terms of a price point, in terms of, and a lot of material is potentially ending up in that sort of clinical waste stream that perhaps doesn't need to. So, product stewardship, what is it? Or at least in Australia. I just put this diagram together just to try and give a bit of an overview. I think when you think about product stewardship in Australia, it's really embedded in a voluntary model, and a lot of the brands, there might be an individual brand that is doing it for their own reasons within a market. It might be encouraged by a state government who's put some investment into a problem waste stream, something that is difficult to manage through your recycling bin. It's typically post-household or post-consumer items. And the yellow there, the brands, but really it's about those brand suppliers, those manufacturers taking on that responsibility for the product along that sort of life cycle. It's encouraging that rather than it for being something that is down to the householder to actually manage and have to deal with. So it's trying to build that responsibility back so that the people that dreamed up the product, designed it, are thinking through that supply chain in terms of where it's going to end up and taking that responsibility for all the way through down the chain, you know, including how it might be reused and or disposed of and or taken back and then recycled, the materials orientated or reused back into new products that they produce. The administrator there is really like a public stewardship organisation, if you like. So they're effectively, the reason why it's gotten quite a bit of, I guess, coverage here in Australia is that the administrator and their service is effectively funded by the brands. So that those costs of that's why I've sort of labelled it yellow. They focus on the marketing, reporting, and then they have varying relationships. So depending on the scheme, they'll focus, like Paintback, I've put there as an example. They spend a lot of time around collection points and they put funding into collection points. Others, like Tyre Stewardship Australia, they focus a lot more on end markets. So the funding they get via brands, and they're able to sort of put a levy on every tyre that's effectively sold in Australia. Some of that funding then goes into a fund, and then it can be funded for end markets for recycled products. So they put funding into that. But as voluntary schemes, the reporting around their, I guess, success or failure is basically down to the administrator of the scheme. And the point I'd like to make is the household, if you like, it is effectively for households, but households, they have very little leverage in this sort of scheme. It's effectively a relationship that can tend to be brands, the administrator, linking to the recycling sector. So you get a real focus around recycling rather than, in many cases, reduction. We'll come back to that. Since about 2020, we've had the Recycling and Waste Reduction Act in play at the Commonwealth level, and the Environment Minister has been able to list products on a priority list. And that can bring a little bit of, I guess, pressure on an existing scheme or an existing industry sector around actions for industry, or what they can place actions around that priority listing and basically establish actions for brands or suppliers to respond to. And depending on the adequacy of the response that they get back, the Minister can then move toward having some form of regulation. The three areas under Part 3 of the Act, voluntary schemes, as I kind of indicated, are pretty much the norm in Australia. Some of them are accredited, some are not. But there is an option to accredit or certify a scheme through the Act. So that brings a little bit more scrutiny around the performance, the outcomes that the actual scheme is doing. Or you can move to a co-regulatory model, which there is, well, the main one was the National TV and e-waste sort of scheme. But there's a number that the Minister has become a bit more keen on to actually have a look at, where the administration of the scheme still remains with, I guess, industry, so the costs, etc. But there's a mandate, the regulations around what the outcomes need to be, what the liabilities of the business need to be, what they need to be doing by a certain time, which is an important point. It basically brings some further scrutiny. And then mandate a scheme where everything is effectively regulated and unsurprisingly perhaps there's not too many of those in Australia. Plastics in healthcare products in hospitals, so that's been listed. And that's really, I think, an important opportunity. It's been there since 22-23. There's two actions: producers to demonstrate improved and measurable product stewardship outcomes, and that can be a range of things: reusability, reduction, recyclability of product, design aspects, and commence design improvements. So how are they making products or packaging more homogeneous? So less complex, less layers of plastics all mixed together that makes it more difficult to either reuse or recycle. Reducing materials in products and packaging. Now, they were supposed to do that first trans and report back by November of 2024. So we haven't heard anything on that. There's probably information and reviews going on within government on that. But at the same time, the government's decided to do a review of the Act itself. Hence what Michelle was saying about making some submissions to that. There's another 3 or 4 months to go on that review process. So there's been no further changes to that priority list, and we haven't heard in terms of the responses from industry and what the next steps may be. But based on some of the comments from the panel so far, one would hope there may be some moves toward some level of co-regulation or mandating around some of that actions. We would hope. Just wanted to consider PVC as an example. It was touched on. There's the Vinyl Council, and you'd be aware there's a recycling program that's in play, approximately 300 hospitals involved in that. It's running at about 5% recovery. Now, I don't want to put that down in terms of the effort and the initiative, but there's an estimate, and these are figures just taken from the website. There's an estimate of 2,500 tonnes that could be available, IV bags, face masks and tubing. So you're running at about 5% recovery. So there's a lot of upscale just with that. And that, I think, is really around a single supplier too. So there's other materials for those items that are not that single supplier that aren't included in those numbers. So you see some of the challenge there. I just want to illustrate a couple of pathways there. Given the diagram I showed you before, you could see a product stewardship scheme really focusing on recycling. So it might be an upscaling of PVC performance, setting targets and trying to maximise recycling happening as a pathway one. The second pathway would be around reduction in PV use, trending toward elimination of some of those products or looking for alternatives. And I've been noting, unfortunately Dr. Michelle wasn't here to be able to talk about healthcare without harm, some of the work that they've been doing, but I note that they've been doing leading a lot of the advocacy in Europe around PVC-free healthcare. And so I've been reading a bit of their information, and also a response from the European Commission, European chemicals agencies around identified risks and starting to, I guess, move things along toward that sort of potential outcome. At least the real focus on some of the plasticizers that I think Professor Thaler mentioned. So it's really about noting, given the evidence, that it's not all about recycling, and we need to make sure that the product stewardship arrangement that's put in play has enough focus on the reduction or elimination of certain plastics out of the system. So as mentioned before, you'll remember that I sort of just touched on, and I think this is the last slide, so hopefully I haven't bored you all to death. But with that diagram that I had before, the focus on the household of not having a lot of leverage in the system, the great thing about health products and plastic products in hospitals being listed is that if we think about the expertise of practitioners, of health sector procurers, and the spend and the potential influence, there's a much more informed an ability to actually have those professionals engaged properly in scheme design elements and really putting pressure on the liabilities of producers through that scheme. You don't often get that for a post-consumer, post-household item because you're really reliant on either councils or collections of councils because they just don't want to deal with the item, or you're reliant on state priority or the Environment Minister in that case. But in this case, I think it's a really important position and something that I think it's been great to support CAHA on their position around that, and I think there's a lot of upscope for that to be happening. And it's a really good time to be advocating, given the review of the Act and the fact that those items are listed in the product stewardship. So I just wanted to try and give a bit of a shout out to those that are in the room and interested. Find the email and make a submission. Thank you.